SDG 3, Good Health and Well-Being, to ensure healthy lives and promote well-being for all at all ages. The Sustainable Development Goals make a bold promise to stop the epidemics of AIDS, TB, malaria, and other infectious diseases by 2030. The goal is to attain universal health coverage and ensure that everyone has access to safe and cheap medications and vaccines. To overcome these setbacks and address long-standing healthcare inadequacies, substantial investment in health systems is required to assist countries in their recovery and create resilience against future health threats. A sizable segment of the world's population still lacks access to basic healthcare services. Addressing inequities is crucial for closing the gap and ensuring equitable healthcare provision. Everyone can help ensure that we achieve the global goals. Use these 13 aims to take action to promote health and well-being for everybody. 3.1. By 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births. 3.2. By 2030, end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births and under 5 mortality to at least as low as 25 per 1,000 live births. 3.3. By 2030, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases and combat hepatitis, waterborne diseases, and other communicable diseases. 3.4. By 2030, reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment, and promote mental health and well-being. 3.5. Strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. 3.6. By 2020, halve the number of global deaths and injuries from road traffic accidents. 3.7. By 2030, ensure universal access to sexual and reproductive healthcare services, including for family planning, information, and education, and the integration of reproductive health into national strategies and programs. 3.8. Achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. 3.9. By 2030, substantially reduce the number of deaths and illnesses from hazardous chemicals and air, water, and soil pollution and contamination. 3. Strengthen the implementation of the World Health Organization Framework Convention on Tobacco Control in all countries, as appropriate. 3. Support the research and development of vaccines and medicines for the communicable and non-communicable diseases that primarily affect developing countries. 3. Substantially increase health financing and the recruitment, development, training, and retention of the health workforce in developing countries, especially in least developed countries and small island developing states. 3. Strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction, and management of national and global health risks. Global progress on SDG 3 as per Sustainable Development Report. There are many indicators like maternal mortality rate, neonatal mortality rate under 5, incidence of tuberculosis, etc., where challenges remain for India, though in areas like life expectancy at birth, adolescent fertility rate, substantial improvement for the intended goal of SDG 3 has been achieved. Check the link in description for details. Now we will discuss about NITI Aayog report of SDG India Index. As per India's think tank, NITI Aayog's SDG India Index for various states and UTs are shown in figure here, categorizing states and UTs in 4 different categories of achiever, frontrunner, performer, and aspirant. These are indicator lists for India's target and achievements so far. Let us know your thoughts on these and discuss with your friends how substantial improvements can be made. Ensuring healthy lifestyles for everybody takes a significant investment, but the rewards outweigh the costs. Healthy individuals form the basis for healthy economies. Countries throughout the world are being asked to take urgent and decisive action to anticipate and combat health threats. This is especially important for protecting vulnerable demographic groups and those living in areas with high illness frequency. By doing so, we can enhance health systems and promote resilience in the face of health challenges. Universal health coverage, UHC, seeks to ensure that everyone has access to quality health care without incurring financial hardship. While efforts to combat infectious diseases such as HIV, tuberculosis, and malaria resulted in significant increases in service coverage from 2000 to 2015, progress has since stagnated. What can you do to help? Let us know your suggestions in the comment box below.